My name is Avery Miller, and I am a cancer genetic counselor at Mount Sinai. Clinical genetic counselors are specialized healthcare providers, and we have advanced training in medical genetics and counseling. And we guide and support patients seeking to understand how inherited diseases and conditions might affect them or their families. And we interpret test results based on personal and family history. Cancer genetic counseling is just one specialty within the field. So all cancer is due to genetic mutations and changes that we accumulate over time, but not all cancer is due to hereditary genetic changes. So when we think about hereditary cancers, meaning inherited risks that are passed from generation to generation, that is actually a very small proportion of cancer in general. The majority of cancers we consider to be sporadic, meaning they happen by chance, which is about 90 to 95% of cancers. And with regard to breast cancer, approximately 5 to 10% are hereditary. And when we're thinking about hereditary cancer, what we're thinking about is a specific genetic change in a gene that is supposed to be protecting us from cancer, but isn't doing its job properly. A gene that can be passed from one generation to the next that could put an individual at a higher risk for cancer, though it's not 100%. And some cancers we consider to be familial, which is where we see that a family has more cancer than we expect just by chance, but we can't necessarily detect a mutation. Familial cancer could be due to small genetic factors that we just can't detect at this point in time, or shared environmental factors where families that grow up together might have similar exposures or similar eating, exercise, or lifestyle habits. When we are assessing breast and other cancers in the family, we look for ages of onset. For example, younger ages of onset of cancer can increase the chance of finding a hereditary cause, though this is not always the case. We also look at certain subtypes of breast cancer. For example, one type of breast cancer called triple negative breast cancer can be associated with certain breast cancer genes. And it is not always about types of breast cancer that are hereditary, but more looking for patterns in the family. So this includes looking for ages of diagnosis of breast cancer or other cancers as well, evaluating whether there is breast cancer in multiple generations, and also how many men and women there are in the family in general, in total. And if someone has had more than one cancer, one individual has had more than one cancer. So we also look for the presence of rare cancers like male breast cancer. And we ask about other types of cancer in the family, such as ovarian, pancreatic, colon, or uterine, and as some genes are associated with more than one type of cancer. So this might help us tailor the genetic testing and incorporate additional genes. And if we find out through genetic testing that a patient might be at risk for additional types of cancer, for example, beyond breast cancer, we may be able to discuss additional screening to promote detection at an earlier stage, and in some cases, preventative surgery before a cancer develops. And as I said earlier, hereditary cancer syndromes can run in families. So a positive result on testing may be helpful for other family members, and a genetic counselor can help coordinate genetic testing for other relatives if appropriate. We call this cascade testing. The genetic counseling process varies depending on the needs of the patient and whether or not they've had genetic testing completed by another provider, or whether they're seeking information and trying to decide if genetic testing is right for them. So a genetic counseling visit typically consists of 1 to 2 office visits, which can be conducted in person or sometimes via video. And that is an initial consult between 30 minutes to an hour, plus a follow-up visit for those who undergo genetic testing. Genetic counselors will review medical history, family history, and ask about 3 generations of family cancer history in both sides of the family, because both maternal and paternal sides matter. And we ask specific types of questions about cancers in the family, including ages of diagnosis and pathology. We will discuss what kinds of genes we can test for, what the test can tell us, what it can't tell us. And based on the risk assessment, genetic counselors will arrange genetic testing for those who choose to pursue it. You can still learn valuable information about cancer risk management and gain information about context from a genetic counseling visit, even without pursuing genetic testing. So for patients who are diagnosed with breast cancer, and this includes males and females, genetic testing results may impact what might be recommended for a person's immediate treatment. So doctors often refer patients for genetic counseling as part of the process for determining next steps in their care. For example, a person who's found to carry a mutation in a high-risk breast cancer gene may be at risk for another breast cancer in the future, a new breast cancer. And in this scenario, genetic testing can help patients and providers choose which surgical option is best for them. So an important part of the genetic counselor's role on the team is to help evaluate the history and facilitate decision-making for the patient so they can make the right choice for themselves. And with the introduction of multi-gene panel testing, which just means we can look for multiple genes at once, that might have contributed to a patient's risk instead of 1 to 2 genes. We can now pick up mutations in genes that are not as well understood, or maybe they're more moderate risk. And the genetic counselor in the situation can use personal and family history to further personalize management recommendations. And another way the genetic counseling and testing are important to breast cancer care is that genetic testing contributes to precision medicine, in that patients may be eligible for certain chemo drugs based on whether and what type of mutation they might carry. So we have a really wonderful team of genetic counselors at Mount Sinai, and more information is available at our website, which you can find by searching for the Cancer Genetic Counseling Program at Mount Sinai in the Division of Medical Genetics. Our genetic counseling team works closely with multiple departments at Mount Sinai, and this includes having genetic counselors embedded in the Dubin Breast Center, as well as the Chelsea Medical Center. For example, if you are a current patient of a doctor at the Dubin Breast Center, you may be able to ask your surgeon or your medical oncologist for a referral to see the genetic counselor there.